Welcome to Neuroseduction, put science back into neuroscience, with me, Levy. Today we have with us Professor Michael Levy. Professor Levy is a professor of neurosurgery at Rady Children's Hospital. He specializes in pediatric neurosurgery and is a pioneer in minimally invasive craniological surgeries. He's also actively involved in research and is widely published. Professor Levy, you have done a lot for the field of neurosurgery. What inspired you to go into medicine and specifically neuroscience?
I think my story is a little bit different in that there wasn't much inspiration. Nobody in my family went to college or graduated from college or really had much of an education. So they didn't understand college. They didn't understand conceptually medical school and such. It was more that I worked in a laboratory in my last year of college. And the person that ran the laboratory was in the Department of Psychiatry at UCSD. And he has essentially asked me what I was going to be doing, once I graduated and finished working there. And I told him basically work in a restaurant, and he was unhappy with that answer. And he's the one that told me that I really needed to apply and go to medical school. So that was kind of the motivation that I had. Is just it's not something I ever thought of, but I'm happy that I listened to him. And my first day at UCSF, I was up in the anatomy lab, just wanted to see what was going on, and there was a surgeon up there that was doing a dissection on a head. And so I went over to see what he was doing, and he was just basically, redoing the anatomy and such, and asked him if I could follow him around, and ended up following him around for the next 4 years. And he was a neurosurgery resident and then subsequently became the chairman of neurosurgery at UCSF. So really just kind of seeing somebody involved in it right away and experiencing it through him is what really kind of motivated me to take that path.
So you've done a lot of work to get to the position you are today, and becoming a neurosurgeon requires many years of schooling and dedication to keep continuing. What would you say the process is like to become a neurosurgeon?
It's long. Many people say about it that stupidity gets you in and pride keeps you there. It's a little bit different now because there are work restrictions and such where you're not living in the hospital every other night, but it was basically 4 years of medical school, a residency, which was 7 years. My fellowship in pediatric neurosurgery was 2 years. And then it took me an additional 2 years to get my PhD in biophysics. So all of that took quite a while. I don't remember much about my 30s, which isn't a good or bad thing. It's just, it's something that becomes all encompassing. And it's your life day in, day out. So it doesn't necessarily go by quickly, but you're always busy. So it does go by.
So if I'm going to shift a little bit more to technology and how that's been changing the field of medicine and specifically neuroscience. So there's a significant role of technology in complex surgery. How would you describe that as a pioneer?
Well, just all you're trying to do is essentially cheat. The more you can cheat the system, the better. Sorry about that.
No, it's fine.
So anything you can do to get an advantage where you'll maximize what you need to do surgically and minimize the complications is of benefit. Practicing via three-dimensional models, what we call stereolithographic models, which is this type of model, say of the skull and the blood vessels. Yeah. So you can practice and look at that before surgery, or even creating a virtual model where you can drive through and around and see your surgical approach virtually. That gives you a distinct advantage. Having a technology that's kind of like a Waze system, a GPS that says you are here, and then can superimpose tumors or vascular malformations into the surgical field. That gives you an advantage. Dyes that you can inject into a patient that will make blood vessels light up or tumors light up, can help in basically performing surgery. Endoscopes, which are historically two-dimensional, making endoscopes that are three-dimensional. I mean, these are all modifications that have made significant differences in how we approach things, how we resect tumors and other malformations, and the success that you have. But all of those things are really of great importance and have made a huge difference, I think, in our ability to deal with these type of diseases.
So COVID has been a big change to many of our lives, and it's affected many different people and has influenced the field of medicine. How have you had to change due to the pandemic?
It's variable because initially in the pandemic, children, just given the mandates of everybody staying home, no school, it really slowed things down at the children's hospital. We didn't see much trauma, so you don't have kids out on skateboards, bicycles, playing sports. We didn't have a flu season, which is a reason a lot of kids will come to the hospital. So it really kind of slowed things down. The children's hospital, like other hospitals, purposely tried to cut down on elective surgeries and everything else so as to kind of be ready for this surge that they were seeing in adult populations that we weren't seeing in kids, but realized pretty quickly that things were very, very normal as far as volume. In fact, we could ramp up very, very quickly. It changed things with regard to getting into a hospital, mandatory testing, mandatory vaccines, which if you're a hospital worker, I think is vitally important. If not for yourself, for immunocompromised children and children with disorders where if they get sick, will really be a significant problem. So that changed. Now that at least in California, that the world is essentially returned to normal, we are seeing a large amount of COVID in kids. I mean, our ICU is full, and part of that is kids with COVID. So it's becoming more of an issue now that people are becoming actively re-involved with life. School's back, sports are back, and most kids haven't been vaccinated. So that's the dilemma currently. Also with ancillary services for disabled kids with brain tumors, vascular malformations, physical therapy, occupational therapy, speech therapy, all of these things need to be done frequently and intensely, if you will, and trying to do so over a Zoom meeting just doesn't work well. So a lot of these resources weren't reaching the people that most needed them.
Okay. I mean, as we've seen, there's been significant changes during COVID. And thinking about the future is another big step to consider how medicine will change to incorporate these, past events. And neurosurgery, like medicine, is consistently changing to incorporate better methods of helping people. What do you think the future of neurosurgery is in the next 10 years? Or what would you like neurosurgery to go into?
I think just getting better at what we do, which is clinically, surgically, scientifically, more in the way of inventions that make surgery easier and safer. One thing I didn't add is the use of robotics for biopsies, for ablating small tumors with laser. I mean, things that used to require large craniotomies, we can now do through a BB-sized hole and they go home the same day. So just, perpetuating these technologies that make a difference and weeding out those that don't. Understanding more about the diseases we take care of. A good example would be brain tumors in kids. We do genomic analysis on all tumors in kids now, and we're really able to better type a tumor based upon the mutation or lack of mutation. It changes the treatment. Now we have biologics which specifically at the mutation and really can turn a tumor off. It changes the way we approach something surgically in understanding, do we need to get a complete resection or not? Is it worth crossing that line and potentially hurting somebody to get a complete resection? So all of these things are necessary to do a better job, to do appropriate retrospective studies and find out if what we're doing as a norm is really the best thing to do. Putting an antibiotic powder in wounds after we finish a surgery, which sounds perfectly appropriate, but doesn't have the science to back it. So all of these things are really important and things that are continuing to occur. An exciting thing about neurosurgery is people are very interested in all of these things. And so there's always active participation and production, if you will, of these different methodologies to make a significant difference. And I find all of that exciting, but it's also very real.
Yeah. And throughout your career as a neurosurgeon, you have published many different papers. So my question to you is, what is the best way to accomplish similar things, even on a lower scale, like for many of us or students?
Probably the best thing to do is to get in to a department or a division, whether it be surgical or medical, align yourself with a physician that is productive and can start you off small, usually with case reports and things of that sort, and teaching you kind of how you write these things up. There's a certain style that's used in publishing, and it's not a difficult style to mimic. It's just something you have to learn. But putting yourself in a position where you can be given the data, you can be given the question that's asked and the answer, and learning how to put it into a form that's publishable. I think that that's the best way to start. You can also work in a laboratory, but it's much harder to get your name on some of the sophisticated papers that come out of top-notch laboratories, and it's difficult to even get a spot in those laboratories. So usually clinically becoming involved, I think, is easier.
Okay, and on top of that question, there are many students who are interested in going to medicine. And what is some advice you can give to them?
Well, I mean, the good and bad about medicine is to get in, you have to get over this initial hurdle, which is not about the individual, but about a GPA and an MCAT score. And so you really need to make certain that you do well in both of those things. To have a strong GPA with a strong science component and just doing really well in the MCATs. The bad to that is there's nothing that suggests that doing well in organic chemistry or biochemistry and knocking the MCATs out of the park makes you a better physician or surgeon. But it's the reality that you have to do well on those to get over that hurdle to get into interviews. Interviews are a little bit better because then they look at the person. When they look at the person, who you are is important, but your background's important, your family's important, your history's important. Have you written any papers? Have you worked in a laboratory? Have you done charitable work? What is your motivation? Or why do you want to get into medicine? Those are all kind of the key things to address. And it's a lot, but right now that's just kind of the go-to with regard to medicine. If your application is not that strong, you can apply to schools that require strong applications, hoping that somebody will see something positive in your application, but you should also apply to places that have a much broader approach, maybe do or do not require the MCATs, that the GPAs aren't necessarily as high, that are more interested in other things about you than just the numbers. Whether that be in the States or in the Caribbean, I think if you want to be a physician, it doesn't matter how you do it. No matter where you go, you're going to work very hard the first 2 years and the second 2 years. So getting in is what's important. I don't think that being blockaded out because of a suboptimal GPA of 3.4 should be a reason to choose something else if medicine is what you want to do.
And okay, so now I have one final question, and this is a little bit different from all the other ones. This question is, we all know the saying mind over matter, but how true do you think that statement really is?
Uh, I mean, it's just, in my training, it's just a very basic sense of just kind of working beyond your limits. Um, just through hours and time and dedication, getting things done. And working hard sets you up in the future for not necessarily working harder, but being used to it, being used to what it takes to do a good job. And I think most people that go into medicine do that. Everybody's lives are different. Everybody's motivations are different. People want to do different things. People want to live their life differently. And so that can determine the type of medicine you go into, or how active you want to be or not be, or even where you want to be in it professionally. Do you want to be a surgeon? Do you want to be a scientist? Do you want to be a politician? Those are all things that are options that you need to decide as to whether you want to do it. But I think a residency in medical school sets you up to be a success. You just need to keep on working. It's hard work that's put into it that makes all the difference. You can go to the beach, or you can write papers. You can go skiing, or you can be in the skull-based lab doing dissections. It just depends on what you want. It's not that one path is better than the other. It's just what's rewarding to you. You need to be happy, and you need to take the path that's going to make you happy. And if being better is important to you, then you need to do those things. But it's not necessarily the right or wrong way. Each path you take has its good and bad. You just need to figure out what is most fitting for you.
I mean, those are all of my questions. So thank you so much, Professor Levy, for generously giving time to us today. I
No, my
definitely, I definitely enjoyed listening to everything that you said, and it was indeed a transformative experience for me and everyone listening.
Oh, great. I appreciate you having me on.